happy to say that after 2 years of much hard work on the part of Duke staff and Conway Medical Center staff, that we have entered into an affiliation agreement with Duke Cancer Network.
That affiliation means the opening of the brand new CMC Cancer Center affiliated with Duke Health.
What's especially important about this, and I take a great amount of pride in this, is that these patients will have peace of mind knowing that Duke, who is one of the top hospitals in the entire country that provides cancer care, and quite frankly in the entire world, will be leading the way to treat our patients here locally. And they, as a part of the agreement, will be providing all of the education, all of the training, the oversight to our oncology staff, our pharmacy staff, the nurses, and everyone else who's going to be involved in providing care to those patients. And we are extremely excited to be able to offer that service to them here locally.
Oncologist and hematologist Dr. Najla Atani will head up the program.
We're essentially going to be taking care of all patients that have both benign blood disorders and more malignant blood disorders. So things that are a little bit less serious and more serious, but also cancers of all types. We'll be offering chemotherapy as well as blood transfusions if they need them, IV hydration, so if they get dehydrated along the way, they'll be able to come in and get their IV fluids there. And then in addition to that, any injections, so if they need any shots or anything like that, they'd be able to get that through our cancer center as well.
And it means getting that care closer to home.
When people are sick and not feeling well, the last thing they want to do is have to get in a car and travel out of town or even sometimes out of state to get the treatment that they need. And there's something comforting about being able to be right here in their home environment and get the treatment they need and get them back healthy and do that in a comfortable way.
A lot of the times we get patients that are scared, confused, and they really need some sort of guidance. And essentially we become kind of like a second home for many. I mean, I'm hoping I'll only see some patients for about an hour and say goodbye, good to meet you. But otherwise, some patients end up with us for months and years on end, and that's basically visiting with them on a regular basis. You know, every couple weeks they'll see both myself as well as our entire team, and then they may or may not need, you know, certain infusions, and so they'll transition over to the infusion center and be able to get, you know, their chemotherapy or whatever it is that they need there. And we'll regularly follow them throughout their course. You know, I think what we want to do is be there from beginning to end for those patients and just kind of hold their hand through it all.